to Unified Conferencing.
Good evening. My name is Adrenia Tolliver. I am one of the Public Health Preparedness Training Coordinators at Virginia Department of Health. And I'd like to welcome everyone to the MRC statewide training for this quarter. Next slide, please. So a few housekeeping notes. Everyone is on mute, so if you have any questions, please use your chat box, and you will find that icon to the right of your screen. Also, please make sure that you registered in Train. If you are viewing in your district, make sure that you sign in with your coordinator, and the coordinator will make sure that I get that sign in to verify your attendance in Train as well. This afternoon, our topic is ICS in a nutshell. Becky McCabe is our facilitator, and she will introduce herself more. Again, if you have any questions, please use the chat box because everyone is on mute, and we will be taking a break. So if you need to, feel free to take one before then, but we do have one scheduled as well. All right, Becky, I'll turn it over to you.
Can everyone hear me all right?
Good on this end.
Happy to be here with you this evening, and want to thank you for two things right off the bat. One, for being a Medical Reserve Corps volunteer, and two, for spending the next hour and a half with us in advance. And I know that's making an assumption that you'll stay with us for an hour and a half. We certainly hope that you do. It's going to be a lot of information in a short amount of time. This is a great topic, Incident Command and the National Incident Management System. The background that I'll share with you about myself is that I am the Western Region.
Hold on, Becky, for a minute.
Sure.
Just we're checking the sound.
All right.
Some individuals saying they can't. I'm going to also provide a call-in number, see if that helps. If you need to try another number.
Just let me know when I can jump back.
Okay, let me just finish typing this in real quick. Right. Okay, so make sure that you have audio, you have that selected so you can hear. On your screen. Okay, and feel free to call in. Okay, Becky, you can go ahead and start again. Thank you.
So anyway, I've been with VDH for about 15 years, and I've been teaching Incident Command and the National Incident Management System for about that long as well. Been in this current position for 5 years in the western part of the state. So currently I am in Patrick County, Virginia. I know we have a couple of folks on this webinar who are in this part of the state. 45 people on tonight, approximately. That's great, from all parts of the Commonwealth, and we're happy that you're here. I absolutely love this topic, and I hope by the end of this session you will as well. I'm going to go back to screen share here, pull that up. A couple of housekeeping items. Adrenia will be monitoring the chat box throughout, so if you have questions, we'll have a couple of opportunities for some interaction, but if you have questions or have any technical difficulties, feel free to type those in the chat box. I won't be monitoring the chat box, so when Adrenia needs to just jump in and alert us or share some of your answers or input, she will do that because she also has control of this system and the audio as well. So as I mentioned, we have 45 people on tonight from all across the Commonwealth, and you bring a wealth of knowledge and experience and backgrounds to this session, so we'll make it interactive. We also want to say that if you have questions later, we'll provide an opportunity for getting you some answers. You have 2 handouts. If you signed in and registered through Train Virginia, then you've already received those handouts. We will use one of them tonight, the scenario. The other is for your reference. We'll be going over the content of that other 4-page handout, but it won't necessarily be critical for your use tonight. And also, the scenario won't be critical. So if you don't have that in front of you, it's okay. We have a method for making sure that no one is lost without either of those handouts. All right, so I'm going to move forward then and share with you some objectives. We have 3 purposes of the incident command system that we'll discuss tonight. We'll explain the benefits of using the incident command system and the purpose of the National Incident Management System, or NIMS. We'll also look at the basic feature of ICS, and again, those benefits are really important, so I decided to put them on both of these slides. Sorry about that, I just noticed that today. And we'll look at the difference between NIMS and ICS. And there is a difference. And also, we'll recognize that NIMS and ICS discussions can be filled with TLAs, or 3-letter acronyms. Those 3-letter acronyms can be pretty annoying if you don't know what they are. So we're going to try to be, I am going to promise to be as free of those as possible this evening. If I'd slip up and say something that is an acronym that you don't know, or a term that you're not familiar with, feel free to put it in the chat box, because we'll not be using jargon tonight. So chat it up and let us know. So first of all, I think it's good to provide a little bit of background and national history. So we're going to look at what an incident is. And way back in 2003, President Bush at the time signed Homeland Security Presidential Directive 5 that directed the development of the National Incident Management System, or NIMS. And now NIMS is required to be used by all state, territorial, tribal, local personnel who have any emergency assignments at any level of government. So it didn't start out as widely embraced way back when, but it is now. Everyone sees the benefits of working together in this type of a national response framework. But before getting too far down that road and talking more about that, I'd like to distinguish between an incident and an event. I know that you've heard them used interchangeably, and even right here on this slide, there's a mention of an event. So what's the difference? Well, I mean, this isn't going to be earth-shattering conversation for your next backyard barbecue but it's important to distinguish if you are called on as a volunteer to know what the two are. Basically, the incident is going to be any occurrence, natural or man-made, that requires a response to protect life or property. So it's unplanned. It can be a weather event, a weather incident, like a hurricane, a flood, tornado. It could be a terrorist act, anything accidental by nature or man-made. But it's something that's not planned. Whereas an event is planned. That's the big difference. It could be, for Medical Reserve Corps, a drug take-back event, which those are done all across the Commonwealth. You may have already participated in one of those. or a district flu exercise. We have a lot of those planned events coming up in the fall. It could be training or a large conference where a lot of people need to be on scene to help. So that's the difference. It's planned versus unplanned. For history, this is Virginia history. We as a Commonwealth adopted the National Incident Management System in November of 2005, and the state coordinator of the the Virginia Department of Emergency Management, also known as VDEM, he is responsible for NIMS implementation across the state. And we'll look at what NIMS is in more detail in just a moment, but what it does is it establishes that standardized incident process, protocol, and procedure that helps any agency work together during any type of incident. So further into that, it's a consistent nationwide approach, as you can read here. It's systematic, it's proactive, it guides all levels of government, non-governmental organizations, private sector, everyone to work together to prevent, protect against, respond to, and recover from the effects of incidents. So tonight's webinar is ICS in a nutshell. So why are we starting off with NIMS? Well, NIMS is the house, and it's the overall structure that everyone in the United States uses to communicate and work within incidents. Different disciplines all come together and understand a common language and a common process through NIMS. Incident Command System, or ICS, is just one brick in that foundation, or that house that you saw. So you see that NIMS is divided into three major components: resource management, command and coordination, and communications and information management. And then the bottom box there is the Incident Command System, which falls under the command and coordination segment. So resource management, that's pretty self-explanatory. That's the management of all of the people and stuff involved in incidents. Command and coordination is just as it sounds. There's a command process, which you'll learn all about tonight, and a coordination process. Communications and information management, again, is pretty straightforward. That's those processes and also the technology for communicating. So again, if you get nothing out of tonight, know that NIMS and ICS are not the same thing, and events and incidents are not the same thing. So more specifically, what is ICS? Well, it allows users, and that's you, a user, to adopt an integrated organizational structure to match the needs of single or multiple agencies. And it's appropriate for all types of incidents. And tonight we're going to talk about all types of incidents. And again, it's the single piece of that overall structure. So it's standardized, it can be on scene, all hazards, and there's a lot of flexibility within the incident command structure. It's also proven. It's based on successful business practices and successful incident management for AIDS. So it's designed to meet the needs of incidents of any kind or size, and it allows personnel from a variety of agencies to meld together in a rapid fashion to be able to communicate and coordinate effectively with each other. As you may recall, if you were around in September of 2001, that one of the reasons for the chaos that ensued is that agencies did not have a framework for working together. Now, of course, that was a tragedy, a disaster, and so in a tragic, huge event like that, there is no real solution for chaos. There will be chaos. However, it was widely determined that some of the processes that happened simply were not going to work if that should ever happen again. The communication processes, for example, law enforcement and fire could not communicate effectively on scene. And there were many volunteers, of course, a lot of people that were local but also across the country deployed. They went there themselves to ground zero to help. And then there were just so many other factors that created the confusion and the disorganization that complicated that event, that incident rather. So that's really where NIMS sprang from. And now here we are 18 years later, and our responses to large incidents, disasters, catastrophes, and even small local incidents has improved greatly as a result. So that's one of the reasons I get excited about all of this. So another thing that ICS is designed to do is to provide logistical and administrative support, and that, as you'll see in just a few minutes, that allows the folks that need to focus on the incident to actually focus. They can focus on operations, they can focus on logistics, they can do what they need to do to save lives and know that everything else will be taken care of. It's also very cost effective because this structure prevents duplication of efforts, which of course saves money. Out where I am, it's pretty rural, as a lot of Virginia is, but it's really rural where we are. And so saving duplication of effort, saving resources by a systematic process is really essential. And resources means people and stuff. So background. Mentioned that ICS was based on decades of successful business practices. This really stemmed from the California wildfires back in the 1970s, which were very bad. They've been very bad, as you know, recently as well. But ICS was developed in response to those wildfires, and lots of agencies responding to California with different processes, different ways of communicating, different lingo and jargon. They all work together effectively. So over time, practices were fine-tuned and developed and became a logical fit in the national management system. Now, you won't find any government entity with any kind of official emergency processes or affiliation that is not familiar with NIMS and ICS. So we have come a long way. And this, of course, includes you. As you know, you had some required training as you started off as a volunteer. That's why, so you would understand the background and the process. So this brings us to today, where we're always looking for ways to improve and better work together. And this whole community approach is a new addition from FEMA, as they learned how to navigate and work some very large recent incidents. And it's called the whole community approach. And what it is that every party must be involved to prepare, protect against, respond to, recover, and mitigate any and all incidents. And the federal government is just one part of that whole community. So the approach ensures that solutions that serve the entire community are implemented, and simultaneously making sure the resources different of the community bring to the table and are used efficiently. Those members include all levels of government, as you can see in this big circle and all the small circles within it. Private sector is huge, and working with the private sector is critical. We can't leave anyone out. transportation, healthcare, public works, communications, of course, agriculture, all are essential in working together and looking at each individual entity's skill level and resources to be best put to use in it. And that brings us to public health. When does public health use the incident command? Well, we use it in response to bioterrorism threats or events and chemical, radiological, and nuclear incidents, disease outbreaks, hurricanes and floods, winter storms, and you may have other examples. In fact, if you do, this is a good time to test out your chat box skills and go ahead and type in an example if you have one. I'll take 2 minutes and wait for you to respond if you'd like.
Someone said tornadoes, and also coordinating with behavioral health partners. Flash flood in Northern Virginia last week.
Oh, yes.
Mass casualty events such as airplane crashes, multi-vehicle incidents on the highway, large public events such as marathons.
All good examples. Excellent. Thank you for typing those in. So we use public health. Public health uses ICS a lot, and we will provide some examples as we move through the program tonight. But ICS can be used for a variety of things. You can even use it around the house, and we'll see how that can work. Let's dive into the actual organization function now. There are 5 major management functions that are the foundation upon which ICS organization develops, and they apply whether you're handling a routine emergency, organizing for a major non-emergency event, or just managing a huge response to a major disaster. So if you already work in public health, this is not your day-to-day organizational chart. And if you have never worked officially in public health, besides being an MRC volunteer, you'll see that this is probably not an organizational chart that you're familiar with either as a student or in any other area of your work life. It's just not a day-to-day hat that you would wear. But we're going to look at each of these functions: operations, planning, logistics, and finance and administration. And you'll see how you probably use them a lot more than you realize. So we're going to start with what is called the general staff. The general staff is critical. These are the chiefs. And starting with one of the most critical, although they're all important, is the operations chief. This individual is responsible to the incident commander for the direct management of all incident-related tactical activities that focus on reducing the immediate hazard, saving lives and property, establishing situational control, basically restoring normal operations. This section, the operations section, is, you can consider, the boots on the ground. So likely this is where you would be plugged in. Just put a pin in that for now. And moving on to the planning section. The planning section and the chief responsible for that collects and evaluates and disseminates incident situation information and intelligence to provide to the incident commander and other incident command personnel. This section prepares status reports. They display situation information, They prepare and document what's called an incident action plan, which we'll discuss in more detail later. Often in public health incidents in ICS, the planning chief is the local health emergency coordinator. The logistics chief, another important section in incident command. This individual is responsible for all service support requirements needed to facilitate the incident, which includes ordering resources from off-site locations and basically getting and managing the coordinated effort to get the stuff, the people, places, and things. They may be the responsible party for booking hotel rooms, ordering food for the incident responders, and ordering supplies, those types of things. So it's a critical position. And the last critical position, and one that's not used for small incidents, clearly, but it could be used for certain incidents that require this, the finance and admin chief. They manage all the on-scene finance and administrative support. So they look at recording personnel time, maintaining vendor contracts, compensation and claims. They conduct overall cost analysis of the incident, and most importantly, they document. You know, you've heard the saying, if it's not documented, it didn't happen. Well, especially with incidents that are large, if there's no documentation, it didn't happen and there's no reimbursement. So FEMA is pretty strict on having that documentation, and without somebody to track the time and the money spent, it's next to impossible to be reimbursed. So the two questions that someone who does not manage this for an incident might be asked are, how much did it cost? And if that person says, well, it cost a lot, or I don't know, neither of those answers will appear on a check that can fund getting that time and money back. So it's another really critical position. So the command staff is the next section of the ICS organization that we'll look at, and that's displayed for you here. And there are three key positions: safety officer, information officer, and liaison officer. And you see by the lines drawn that these all report to the incident commander. So that's why they're called the command staff. And looking at each one, the names are pretty much self-explanatory. The liaison officer is responsible for coordinating outside agencies to get them what they need in order to respond to an incident. A lot of larger incidents have multiple agencies in response, and if somebody is there to coordinate and then to report to the incident commander and be that liaison to the incident command, then it goes a lot smoother. So that's the liaison officer role. The safety officer is responsible for the overall safety of the incident, and that includes the safety of the responders and all of the staff involved. And the information officer, or sometimes called the PIO, or public information officer, also reports to the incident commander, and that's also pretty obvious. They are the media person, and they coordinate the media, they respond to the media, they develop messaging with the media, they sometimes work in coordination with other agencies, so they may establish a joint information center and work together to develop media messages. So that is the command staff. And what we just talked about in the prior slide was the general staff. So those two groups of staff report to the incident commander. So within this process, formal communications flow up and down. Tasks are delegated down, and feedback works up. So similar to what you may be used to in the workplace, informal communication can flow back and forth across those sections. In other words, if you work in the operations section, certainly you're talking to folks in the logistics section, finance, or planning section, but you're not taking your direct orders from those folks. You're taking your direct orders and task assignments from the individual above you, your supervisor. So for incident command to work, the tasks are delegated down and the feedback works up. And information kind of flow back and forth across the sections informally, but not formally. All right, so now we're going to look at examples of all of this in a public health setting. Let me go back. You're going to be looking at this slide, and probably it would be more useful as we're talking about the public health setting. So let's talk about a flu point of dispensing exercise, or a flu pod. And while we're doing that, just to make it a little more interesting and real, I always like to keep things real, think about in the back of your head a wedding event and who is organizing a wedding. I don't know about you, but June and July are busy wedding months, and I've had 2 recently. At the end of June, my brother-in-law got married, and I was invited to one of my best friend's weddings in Seattle in August. I can't go to her wedding, but I did talk to her about it last weekend, so I'll share some of that with you as well. So just be thinking about that if you've ever attended a wedding or coordinated one as we go through this. So for a flu point of dispensing exercise, where during flu season we administer flu shots to members of the public in an exercise setting, and we time their start time and end time to measure throughput, we call it. Sometimes it's set in a drive-through setting. Sometimes it's set up in a school setting, or it could be even, there's so many different locations across the Commonwealth. But the purpose is to distribute that vaccine and to make it as real to an exercise as possible so that we can test our processes. So for that, an incident commander would be oftentimes the health director, the local health director. And the safety officer is going to ensure that all the staff and the patients are safe at the location. They would provide a safety briefing before that exercise. They're going to be monitoring the weather. They're going to be, if it's indoors, looking for cords on the floor or any trip hazards. If it's set at a drive-through, for example, they're going to look at what's happening outside to make sure that staff aren't walking in front of cars, that cars aren't driving over staff members' feet, that type of thing. The information officer is going to coordinate media and public information before the exercise and possibly even during it. Sometimes we have we start news organizations covering our flu pods. There might be the health educator for that health district, or the public information officer, someone who's assigned those duties at the health district, or maybe a regional public information officer for VDH. The liaison officer, that officially might not be a position that would be established in this example, but they would coordinate outside agencies or participants if it's a large exercise, and that could be the district business manager. You'll definitely have a planning section chief, and that individual often is the health emergency coordinator, and they have pre-planned the event. They coordinate the planning during the event. They may be the planner for the incident briefings and the after-action review meeting after the exercise. The operations section chief, and that individual, as you know, is in charge of the operational components, all of the activities of that exercise. Often that is the nurse manager or the epidemiologist. The logistics section chief, that person's going to coordinate the on-site, getting all of the supplies needed, the facility, coordinating the logistics of booking the facility, making sure that there's food and coffee for the staff. Often that falls to the business manager or a human resource person at the health district. And then finally, a finance or admin section and section chief, that may or may not be applicable for a flu exercise. Again, it depends on the size and the scope. They may be a lot more involved in larger health districts than in the smaller rural ones, but it is crucial to track time and expenses if that's needed for the district for something like that. But typically that's not a section that's stood up. So that is a public health example. Now, I know you may have been thinking about your wedding example. While we're going through it, if it's a large wedding, the incident commander might be the event planner, the wedding planner. And I always think about who's paying for the wedding. That person may be finance or admin chief. And regardless of which family pays for the wedding, there is someone that's going to be a finance and admin section chief in that organization. I don't know if you would need a liaison officer for a wedding, but perhaps. Sometimes I see the maid of honor taking on that role. And what made me think about all of this was my conversation with my good buddy in Seattle. I was telling her why I couldn't make, and she said, you know, there is another option. And I said, what's that? She said, well, we're going to live stream the wedding, the ceremony anyway, not the reception, through Facebook Live. And I said, oh, great, we'll be there. And she said, I have to figure out how to do it first, and not quite sure yet, and I'm thinking to myself, wow, you've got 3 weeks. And she said, well, I know I'll figure it out. And I'm thinking, finally, I just said it because, you know, honey, you need to delegate that task. And what she really needs is a public information officer that can just run with that and do it, and she doesn't have to worry about it. So we'll see what happens, but those are the ways you can think about incident command for some everyday events that happen that can be quite large and can be kind of complicated as well. So moving on, you've looked at that slide for a long time. I appreciate your patience. Next, the point for this is that the chain of command can be expanded or contracted based on the nature and the extent of the incident. It expands, obviously, if an incident grows, and it contracts if all of the positions are needed. So in this example, planning, operations, logistics, and finance all have expanded to include either units or branches and divisions and groups, depending on where they fall. A lot of this detail would be asked on some of the IS 100 exams that you may take after you complete this webinar, and it's good to know that they expand, but it's also good to know that they contract. The only position that is really required to be filled at all times during an incident is the incident commander. Incidents can expand over time, and those positions are added, and then they can go away as the incident winds down and things are more manageable. So a couple of things to keep in mind is that the incident commander has always the overall responsibility for the incident, and that standard terminology is always used to help reduce confusion between the incident command system and any day-to-day positions of staff members. So next we're going to look at the flow of requests for information. And noting here, as you're looking at this slide, that everything starts locally and ends locally. And we do have an acronym, a couple of acronyms that we've thrown onto the slide just to make sure that you have your dose of TLAs. The first acronym is EOC, and that stands for the Emergency Operations Center, and every jurisdiction has one. And the other acronym here is NGO, and that stands for non-governmental organizations. For example, the Red Cross is an example of that. So resources at the local level need to be exhausted or anticipated to be exhausted before state and federal agencies can provide any official assistance. And also, declarations of local and state emergencies need to be declared before federal assistance will begin to arrive. So as you see, the request flows up from the local emergency operations center to the state emergency operations center, and then to federal agencies and departments. And the assistance flows back down that way. And if the state cannot provide the resources, that's when federal agencies and departments become involved and provide assistance. If the state can handle it, it does not go any further. Conversely, if a locality or anyone in neighboring jurisdictions can handle it, it doesn't necessarily need to go to the state. So this slide actually came about as a result of feedback that we got from an earlier ICS in a nutshell class, and we put this together to explain the flow of requests for assistance, because it was assumed, it shouldn't be assumed, that everyone knows how this actually works. And when you get into the weeds of it, it is kind of a complicated process, but that's it in a nutshell, if you'll pardon that phrase. All right. We have a quiz planned, and it's a very easy quiz, but before we do, I think we should take a 5-minute refreshment or bathroom break to digest what we've talked about, and then we'll jump right into the quiz. It's going to be interactive, where you use the chat box, and then we'll resume. So, Adrenia, I'm looking at my clock now, and it's 7:12, so I'll be ready to start back at 7:17. Does that sound okay to you?
Sounds good.
Okay, thanks.
Okay. So we'll all take a break. Thank you.
Okay, we're back. 5 minutes went quickly. So, you know some examples of how ICS is used to manage incidents. Which of the following situations do you think represents another reasonable use of ICS? And the way to interact here, again, is the chat box. If you don't want to type your responses into the chat box, that's fine. You can just lurk and learn. But if you do, feel free to interact at this time. Here we go. Ready? The coordination of a regional drug take-back event for MRC volunteers. So is this a reasonable use of the incident command system? And really, a yes or a no answer is fine for this.
Everyone is answering yes, Becky.
Awesome. That's the right answer. It's yes, absolutely. And the reason is it's kind of operational. It's a process with a lot of moving parts. There's public information, there's MRC volunteers, there's different sites, locations, and it's definitely an event, not an incident, but it's definitely got all the makings for using the incident command system. So good job. Next. The calculation of total volunteer error hours for the month of May 2017. Is this a reasonable use of the incident command system?
I'm getting a no response. Everyone's answering
From everyone or just one person?
Everyone.
All right, excellent. And that's correct. It's a task. One person can do it. Okay, next. The oversight of volunteer safety for a door-to-door tetanus vaccination effort following a tornado in your region.
We have all yeses and one no response.
Okay.
And then someone responded, it's such a specific oversight task.
Yeah, and that one is a bit tricky. Overall, looking at it in a couple of ways, it's a process and it can involve a lot of moving parts. So it could be operational, it could be the safety officer who would report to the incident commander. So we're looking more for a yes, but I can see how it would seem like it's a task to just oversee that safety for one volunteer to go door to door. But if you think about it in terms of a huge tornado hitting a community, multiple volunteers are going to multiple neighborhoods to assist with tetanus vaccination efforts, it could definitely be more of an incident command opportunity. So, one more. The coordination of supplies, badges, T-shirts, etc., for volunteers at a health screening event for the community. And now think about, because this one's also tricky, think about it as it's a health screening event. It's an event.
We have a couple of no's, mostly yeses. A response here that reads, that part of logistics, I would say yes. Logistic coordination is involved, so they would say yes to that question.
Excellent. And that's probably where this position would fall under is logistics. And I say it's tricky because the event would certainly need to use incident command to coordinate, especially if it's a large event for the community. A health screening event has a lot of moving parts, and moving parts means incident command is useful. If you said no, I can understand how you could think that if you're thinking about maybe a person just handing out badges and T-shirts for volunteers as they arrive at the event to work it. That's certainly a task, and I can see how that would be a no, but overall we're thinking about that event and the coordination of all of the moving parts. Might look to word it better next time, but I think everyone has the idea for how and when incident command is used, and that's the point of the quiz. So good job, and thank you everyone who interacted and typed your answer in the chat box. Okay, so moving to talk about common terminology. We know that it's essential to provide efficient, clear communication, and ICS actually requires the use of common terminology for organizational functions, for resource descriptions, and for incident facilities. Some of the organizational functions, when incident management responsibilities are named and defined, the terminology has to be standard and consistent, because if you think about it, everyone in the country is using incident command. So when those functions, the organizational functions that we've been talking about, those have to be consistent for everyone to understand what everyone else is doing. And the same for resource descriptions. There is an infinite number of descriptions of resources within NIMS. Those resources are people, their skills and abilities, and items like bulldozers, ambulances, and every other kind of resource you can imagine involved in incidents. All of those have been described within NIMS so that we're all speaking the same language when we're requesting resources. And the same for facilities. When somebody says at an incident in Alabama, just report to the staging area, that same phrase, staging area, is going to make sense to someone working an incident in Oklahoma or Florida or Virginia. The Joint Information Center means the same thing all across the country, and the same for incident command post and other incident facilities. So we're using the same terminology in the same plain language to communicate during incidents, and that's critical, as you know from our prior discussions. So about plain English, no radio codes, no agency-specific codes, no jargon. There are some real scary stories out there about how lives have been lost because one agency used a code that another agency misinterpreted, not using the same code, and lives were lost. It's a sad thing. So plain English eliminates all of that. And ICS is managed by objectives. Everyone involved in an incident or an event uses objectives. In other words, what are we trying to accomplish and how? And so they're developed and communicated in a specific way. And you've probably heard the acronym SMART related to objectives. And it means people have different definitions for some of these letters, but most widely adopted are specific for S, measurable, achievable, realistic, and time sensitive. So it's a SMART objective. ICS objectives are always SMART. And incidents have either a verbal or a written incident action plan, and that just means it outlines the incident objectives, it states the activities, covers a time frame, and that time frame is called an operational period. And I said it can be oral or written. If it's a large incident, it's always written. If it's something small, it can be just an oral incident action plan. I used to teach this class a lot and had some firefighters in almost every class. And an example of an oral incident action plan is when a fire truck rolls up on a fire, they don't stop and get out a Word document and type their objectives. They know what the objective is, and the chief is the incident commander. So their incident action plan is what to do to put out the fire, save lives, save property. And the time frame is however long, that operational period is however long it takes to get that accomplished. So there doesn't need to be anything specifically in writing for something like that. But for a large public health incident that spans a good bit of time, for example, an Ebola outbreak or a hepatitis A outbreak or something like that, it will be written and it will cover all of the objectives that are needed to deal with that incident. So incident and action plan has 4 elements. It's pretty straightforward. What do we want to do? Who's responsible for doing it? How do we communicate with each other? And what's the procedure if someone is injured? So some other examples of where we use incident action plans are for when we do a pre-event incident action plan, like NASCAR races in Martinsville, the RAM event, remote area medical event in Wise, the large bike race that happened in Richmond several years ago, Unite the Right rallies in Charlottesville, presidential inaugurations and 4th of July celebrations in Northern Virginia. Those are examples where an incident action plan is written. The FEMA forms are included, and that information is shared before the event. So a few more ICS concepts for you. In the Incident Command System Organization, there's no correlation with the administrative structure of any other agency or jurisdiction. It's just a structure on its own. And that uniqueness helps to avoid confusion over different position titles and organizational structures that may also be involved. And someone who serves as a chief every day, like that fire chief I mentioned earlier, may not hold that title when they're deployed under an incident command structure for some other type of incident. So our day-to-day hat is taken off. And speaking of hats, there's something called the span of control within incident command. And that is the number of individuals that one supervisor can manage effectively during an incident. Now, the key word here is effectively, because I know you all have been in organizations or activities where one person supervises a lot of folks, but is it effective? Over the years, ICS has determined what that ideal span of control is. And what do you think that number is? Let's do another quick chat box interaction. I think we have time for that. What do you think the ideal number of individuals one person can manage during an incident would be?
Okay, so far, most of the responses, the number is 5, 5 to 7, 3 to 7, and a couple of folks mentioned 10.
All right. That's a good range. It would be between 3 and with the optimum to supervise being 5. Now that's talking about direct supervision. The incident commander, of course, is responsible for the entire incident, and there may be a lot of folks under that individual, but they are not directly reporting to that incident commander. So ideally, it's between 3 and 7. Thanks for chatting on that one. This leads us into a couple of concepts regarding chain of command and supervision. Chain of command, I know you've heard that phrase before. It's the orderly line that details how authority flows. We mentioned this earlier. It allows the incident commander to direct and control the actions of all personnel on the incident. That doesn't mean that the incident commander is a micromanager, far from it. But it avoids confusion by requiring that orders flow from supervisors. So you can imagine the chaos that would result if orders didn't come or task assignments didn't come directly from supervisors. So chain of command and unity of command are concepts that are discussed in the IS 100 online FEMA course, and I want to just take this opportunity to clarify that this webinar that you're listening to tonight does not substitute for that. You still will need to take that online course. However, when you have this content under your belt, you'll be better prepared to take that exam and pass it. I don't cover all of the material in that course, but quite a bit of it here, enough for you to really be a step ahead, and by the time you finish that, you'll be easily able to pass that course and the online test. So chain of command relates to the overall hierarchy of the organization, and unity of command deals with the fact that all individuals have a single designated supervisor that they report to. So based on the principle of unity command, you will report to only one incident command system supervisor, and you will receive your work assignments from your ICS supervisor. And when you're assigned to an incident, you no longer report directly to your day-to-day supervisor. If you happen to be already in public health or happen to know a supervisor in an incident. So that the ICS nuggets of information that kind of summarize what we've talked about. The incident commander has overall authority, standard terminology is used, span of control is optimally 5, but it can vary from 3 to 7, and incident action plans are used to establish the objectives, the strategies, and the tactics. So, time to play your best guess. Another opportunity for some chat boxing. If you prefer not to, then you can lurk, that's fine. Question: which incident command position is responsible for all incident activities, including the development of strategies and tactics, and the ordering and release of resources? So type your answer in the chat box.
Incident commander is the response, pretty much from everyone.
All right. And that's the answer. Thank you all very much. Good job. Next.
I also had a question from the chat box, Becky, if I can give that to you.
Sure.
There was a question asked: who appoints the incident commander? Is that position pre-assigned?
Excellent question. Sometimes it depends on the incident, and that's kind of a wishy-washy answer, but it really does. I'll give you an example. For the fire example that we just mentioned, the fire truck rolls up on a fire. Everyone knows who that incident commander is because it's the person in the most senior authority position. And that's, you already know it's going to be that chief of that unit. In a public health incident, it could be the incident commander is the health district director, or it could be that that's not an appropriate position and that would be assigned either because VDH is more centralized assigned by the central office, or because it's not appropriate for a health director because the epidemiologist is the most appropriate person to be the incident commander. So it really does just depend. If, for example, an incident happens where, let's say there's a shooting, trying to think of an example that everybody has heard of and can hopefully not relate to in person, but you hear about it in the news, a school shooting or a shooting at a movie theater. Whoever arrives first as a responder, let's say that the local sheriff's department arrives first on the scene, that senior person is the incident commander until that incident command is transferred officially to someone else. Let's say that the FBI arrives shortly after. The transfer of command happens, everyone is briefed, and the FBI head is on scene as the incident commander. So there's a whole process, and it really is very incident specific, but there's a process of transfer of command. So one incident commander is officially handing that responsibility over to another, and then everyone involved in the incident knows who the new incident commander is. That can also happen if there are multiple operational periods and one person can't do it for an extended period of time. So that transfer of command can happen that way. I know that was a really long answer, but it's an excellent question. I'm glad you asked. Hopefully that answered it for you. The next best question is, as a volunteer, which section chief would you likely work under during an incident? Logistics, planning, or operations?
C, operations, is the response.
That is correct. And you know what I just noticed? Operations chief is the answer. It's C, not B. So my mistake on that, I apologize. But good answer. Of course, again, this is not hard and fast. It's likely, but not always the case. There are always going to be exceptions, but good guesses. Thank you again for participating. And now it's time to look at the scenario. Use ICS and public health, and this is a fictional town in Virginia. However, the scenario is based on real life, so something similar to this actually happened. And for those of you who do not have this handout in front of you, it's okay. I'm going to read through it. And as I'm reading, and I hope to make this as concise as possible, but I also want you to be thinking about what you've learned so far and try to apply the concepts that you've learned to this scenario as we go through it. Because the incident really did happen, some of the details have been changed, but this kind of thing does happen quite often, and it's what we do in public health for incidents like this. So, it's July 12, 2019. It was 4:15 on a sunny Friday afternoon when the call came in. The epidemiologist knew when she hung up the phone that it was going to be a challenging case. Little did she know just how challenging. A female hospital healthcare worker was diagnosed with pulmonary tuberculosis a few days before her death, and this individual had worked in the local hospital system for many years, and prior to her death, she worked in the cardiology and rehab departments. She potentially exposed over 1,000 patients. The town of Mountain View is located in the southwest corner of Virginia, and it's a growing community with each year hundreds of people moving there to retire. The main economy is tourism, with lots of parks, lakes, cabin rentals, and a new winter ski resort to draw visitors to the area. As soon as the call came in, the health department staff went into action. In collaboration with the hospital, the decision was made to screen all close contacts for tuberculosis infection or active disease. A mass screening clinic was scheduled for July 18th. An incident command system was set in motion, and the local health director became the incident commander. An Emergency Operations Center, or EOC, was stood up in the hospital. Fortunately for this community, the health department and local EMS, that's Emergency Management System Services, and law enforcement and other agencies had just conducted a chemical spill exercise 2 months prior to this outbreak. And during this exercise and the after-action meeting, important relationships were formed with key players in the TB outbreak. Some of these players included the health director, the nurse manager, the business manager, the health emergency coordinator, the chief of police, the hospital administrator, local media, and VDH, and local public information officers. So because ICS was adopted as the response structure, the span of control for each of the section chiefs averaged about 5 employees. And the exercise demonstrated clearly that if the chief has to supervise more than 7 people, the system and its effectiveness breaks down. So public information, as you can imagine, it became critical very early. The citizens learned about the outbreak before the media could report it. And that's going to happen with social media, right? And so rumors started flying quickly. The rumors scared parents who took their kids out of schools and daycare centers, and the media worked closely with the public information officers to get accurate information out about the case. But the rumors caused problems from the start. A joint information center was established to create the various public information entities, to coordinate rather. And this helped give a consistent message to the public because each message was developed in a collaborative process. All the messages were reviewed and approved by the incident commander before they were released to the media. So overall, that outbreak response was a success. Only one case of active tuberculosis was found in over 1,200 patients screened, and the patients were pleased with the screening process overall. 2 weeks following the clinic, the health department coordinated an after-action meeting to review all of their lessons learned, and an after-action report was written and distributed to all that were involved. So let's talk about that scenario. Thank you for listening to me read it. I did not want to do that, but I know that some folks didn't have that in front of them, so I hope that was helpful. What functions or activities do you see for Medical Reserve Corps volunteers to support this incident response? And feel free to type your thoughts into the chat box. This one is a bit tricky.
Okay. Okay. Some of the responses, call center, PPDs, screeners, check-in, disseminate information, help with social media, help with testing perhaps, medical history documentation, provide information on screening procedures. Nurses could potentially assist with TB screening.
Those are excellent.
Providing information to PAO about prevention, fitting masks, getting the word out about free testing, language interpretation, TB vaccinations.
Yeah, those are all very good responses. Thank you. There's so much opportunity for a volunteer to support in that response, and they would be needed. You would be needed. So you have all of the skills and then some to help in that area. The next question: general staff position might the district nurse manager serve in during that outbreak? This one is pretty easy, so we're not going to spend a lot of time on it. Go ahead and chat it up now.
Operations, operation or clinical operation, section chief.
Yep. Okay. Good. That is very likely where the district nurse manager would be. And again, it's operations, the boots on the ground, and that's really what the operations chief does. The nurse manager having the skills and knowledge and also experience to serve as the chief in that role. Good answers all. Thank you. And the last question: during your shift while working this incident, you noticed that a critical supply is running low and about to run out. Who would you report this to?
My supervisor, direct supervisor, section chief. Depends on what my position is. Logistics supervisor or officer.
All right. Well, you have the idea. It's your supervisor. And whoever your supervisor is, that's the person responsible for relaying it up to get those supplies replenished. So you're reporting that up and not across the organization. Good answers. Thank you. So you've provided some answers. Are there any other questions about the scenario or anything that we've talked about so far that we can clarify for you before we start to wrap up? If so, we'll take just a minute and look at them in chat.
No questions on this end?
All right.
Oh, we have one.
Okay.
It says your handout had area command. Is that going to be part of this webinar?
It is not. Can answer what it is very quickly. It is in some of the online training. Area command is a really good example for public health, and that's when the incident covers a large area, like for example, a large outbreak. Let's think about maybe Ebola or something that's impacting the whole Commonwealth, like Zika. Because the Department of Health is centralized and we have a centralized function and process, some of that incident is managed at the central level by the central office in Richmond, and then some of it's managed locally. And you can you can kind of see how that could be the case, because we have to have a consistent message across the state, and yet we're doing different things locally within each health district across the state to manage that incident locally. We have different educational activities happening, different vaccination activities perhaps, just depending on the incident. So area command is where there are different commanders locally that all report to the area command, which would be, in this kind of example, the central office. There's still incident command locally, but it's addressed by a larger area. That's a very quick, simplistic answer, but it is covered in more detail, especially when you get into the higher levels of the incident commands classes like ICS 300 and ICS 400. Great question. Are there others?
Yes. In a national incident, is there an incident commander for each locality?
In a national incident, there is an overall commander, but more than likely it's going to be what's called unified command. Because of a national incident, well, again, it's very incident specific, but let's take, for example, a large hurricane that covers a large geographic area. Of course, there are many organizations involved in that response, and they all have an equal say and equal jurisdiction over helping the public to respond. So you would have that unified command approach where everyone decides together what those objectives are and what the activities, strategies, and tactics are for addressing the incident. But the structure for incident command is expanded so that there are units, there are groups and divisions below all of the sections that we've discussed, and it really gets down into a very detailed level. So those commanders are perhaps over just sections, but those sections involve hundreds and hundreds of people to do what they're charged to do. So that's an example of a very expanded ICS structure that is under a unified command rather than having just one commander over everything. Because for keeping with the hurricane example, you've got everyone from Coast Guard to fire to water authorities to jurisdictional levels. So there has to be that overall structure and command, but it's going to be handled locally, serving that command, if that makes sense. And regarding unified command, that's also covered in a lot more detail in the higher level ICS courses.
And last question, is there an app that serves as a walkie-talkie between supervisors and us if you are not in the immediate vicinity of the supervisor?
An app? I'm guessing like a software app?
Yes.
For that communication? Not that I'm aware of. In public health responses, what we do, or public health incidents or large planned events, we have handheld radios or walkie-talkies, but we haven't used apps that I know of. Now, on large events, like one comes to mind, the Unite the Right rallies in Charlottesville, where there was a unified command structure because many agencies were involved. An app was used to serve as a virtual emergency operations center, and that was a great tool for communication in terms of what we use within VDH and smaller incidents that not that I'm aware of. Good questions all. If you have other questions, even if you go forward in your day tomorrow or you're thinking about later and you wish you'd asked, feel free to contact Adrenia, and she can forward those questions out and we can get the answers to you. We do want to make sure that this is a learning opportunity, and learning happens when your questions are answered. So we want to make sure that you have that follow-up opportunity. Also, we have one more question. This is kind of the $50,000 question for the evening. Is this NIMS or ICS?
Everyone's answering ICS.
Excellent. That is great, because that's the right answer. It's not NIMS. So remember that one day you might be a non-leader in your current role in day-to-day operations, but you're placed into a position of leadership, and know that you can do it. You're asked to do it because you have those skills and abilities. Or you could be a leader and you're placed into a position of non-leadership. You're not going to have the same day-to-day hat that you will in ICS. You can apply ICS during your everyday activities, and that's really a good way to learn about incident command, is to just try it out on something. You're planning your nephew's graduation party. Apply ICS to it and see, of course you're going to be the incident commander, right? But see how much you can learn by actually doing it and using it. It doesn't have to be during an emergency. Also, know what your individual responsibilities will be for all emergencies, and that you and your family are prepared, and that's how you can best serve others, is to be prepared at home first, and ready to, if deployed, be deployed to serve your community. I did hear from Adrenia that we have one question about FEMA's role in NIMS, and if I have that right, Adrenia?
Yes.
Okay, so NIMS is the incident management system, and FEMA implements that system. FEMA is the organization that implements the system and is responsible for that implementation. So they have the training organization that provides the courses that you see online and that you may take online. They have the boots on the ground to respond to large incidents. They're the federal arm of that assistance that comes, but they're utilizing that incident management system along with everyone else. So they're kind of the ones to bring it to everyone else. So I hope that answers that and clarifies. They're one organization within the whole system, but they're charged with that as well. So I want to say thank you. We're breathing down on the 8 o'clock hour, and that was a very quick 90 minutes. I hope it was for you. I want to, before I turn it back to Adrenia, just say thank you for what you do as a volunteer, for giving your time and your talent to your community and to VDH. It's very much appreciated, and your attention and participation tonight is appreciated. And also I want to thank Adrenia for coordinating every aspect this webinar and being such a great help to me. Thanks a lot, Adrenia. So I'm going to turn it back over to you.
Okay. All right. Thanks, Becky. Thanks, everyone, for sharing your evening with us. You should get a evaluation after I put your information into train that you have attended tonight, your verification. You will get an evaluation, so please take time to complete that. If you have any future webinar topics, please go on to www.bamrc.org and or the email, I should say, and provide those topics to us. I'm sure Jennifer and I would appreciate that. And that would be it for tonight. Please look forward to receiving the PowerPoint. And if you have any questions, please let us know. Have a great evening.